All right, the last little bit here for chapter 20 is just some clinical terms that I've added here at the end. These are things that are in your objectives for lecture. Things like disorders, cardiovascular system, lots of terms and conditions. And these are on Quizlet in the lab page as well, I believe. So first up is on page 790 of your book. This is called angioplasty, and angioplasty has to do with clogged arteries, basically. So atherosclerosis is a hardening of your arteries. Generally, it's the elastic arteries that are nearest your heart, or maybe the muscular arteries that are out a little bit further away from your heart. And what happens here is the inner layer, that tunica intima, gets thicker, either from inflammation or due to plaque builds up. And what that's going to do is narrow the lumen. And if you narrow the lumen, then your blood's going to have a harder time fitting through there, like you see in this picture here. So some risk factors here that they talk about in your book are hypercholesterolemia, high blood cholesterol. So we'll talk more about that when we get to the digestive chapter, but high cholesterol levels are very, very, very linked to having these plaque deposits. They're cholesterol plaque deposits in the arteries. So treatment of atherosclerosis is angioplasty, and some really cool pictures here in your book. What they can do is basically put a balloon in. They would insert it with a catheter and then blow it up and puff up your artery and make it normal size or even a little bit bigger. And they can also add stents. So balloons and stents are what we're really looking at here. So you've gone from having a really narrow lumen there to now having a pretty much fully functioning blood vessel. And the balloon doesn't stay in there forever. They usually just use that in there to get the stent in place, and then they take the balloon out, or maybe just deflate it. I think they take it out. So that is angioplasty and atherosclerosis. Sclero, if you've heard of that before, means hardening, so that's where part of that word comes from. And athero, I believe, means artery. So all right, and then an aneurysm. So this is in near the same page, and you've got good pictures here. An aneurysm is when you have the arterial wall gets thinner over time. Usually you see this in older individuals, or it could also be due to inflammation. But the artery wall is going to thin, and because of pulse pressures and things like that, it's going to balloon out. So you go from being this nice little thin aorta to a ballooned out state. That's no good, because you're putting extra stress on the wall of the arteries there. And so what happens is you've stretched it out further than it should be stretching, and it's a constant stretch. It's not recoiling and going back to an original shape. So it's prone to bursting or rupturing. And so, I mean, if this was an abdominal aortic aneurysm, you would probably die of that, because that's a giant artery in your abdominopelvic cavity, and you would just be bleeding out, essentially. Well, bleeding in, because it would be on the inside of your inside of your body, and you could bleed to death. So sometimes they happen in the brain, sometimes they happen in the aorta. Sometimes they can watch them over time and fix them when they're starting to get too big and too scary. But lots of things can cause this. Cigarette smoking causes this, because cigarette smoke causes so much inflammation on the blood vessels. I believe diabetes is a risk factor as well. So do good things. Take care of your body. A few pages later, you see another clinical view on varicose veins. And this is a problem in your veins, of course, and it's a problem with the valves of your veins not working right. So, you know, those valves, we've seen them, they are in your veins and they'll open and close to push the blood up from one section. It's kind of like bamboo, from one section of the vein to the next to the next. Well, if your vein's not working right, and maybe it just kind of stays open, so instead of blood being pushed up, it'll fall back down. So that's what's happening here. The blood kind of pools and gravity pulls it down into your legs. So these are most often seen in the legs, and it can really cause the vein to swell up a little bit. And risk factors for this are standing too long. There's some other genetic risk factors just with your cardiovascular health and valve of the vein health, and obesity too because of all the excess pressure. So that's varicose veins. It's not just that they look weird or your legs are kind of disfigured because of it, but it's really non-functional, so that's not a good thing either. And then this, I pointed to this little box on the last video that's in that big 2-page diagram on hypertension and hypotension, so you can read that again read it if you didn't already. But this is low or high blood pressure, so neither one is good. You've got to have high enough blood pressure to push your blood and perfuse all of your tissues, but you don't want to, so it can't be too low or else you're not perfusing your tissues very well. But you don't want to have high blood pressure because it causes damage to your blood vessels. So there's that little sweet spot, and like around 120/80 is the round average, and that just depends on your age and how athletic you are and things like that. So normal range is anywhere from there to there. And then low blood pressure, of course, down here, and then high blood pressure and super high blood pressure there. Kind of crazy, but yeah, mine was, let's see, mine was 130s, 150s over 90 something. So I guess I was still in the mild range, but I was floating around to that moderate range when I was having the crazy head pains last year. Anyway, you know, from time to time, having high blood pressure is certainly not going to be as bad as having chronic high blood pressure. And I think they talk about some of that in that clinical view box as well. Hyper, you should remember this term. Hyper means too high, and hypo means too low. And it's tension because it's the blood pressure, the tension or the force of the blood on the vessel wall. So hypertension is high blood pressure, and hypotension is too low. And some good rules here. Things to do, things to eat, things not to do to keep your blood pressure in check. The end of chapter 20. Good luck, and let me know if you have any questions.